set and network mapping. So our conversation today will be, as I mentioned, 45 minutes. This is a short and sweet thing. So we are just going to be heading through content. And we begin, I just want to share a little bit about the Population Health Innovation Lab. So, our mission at the Population Health Innovation Lab is really to create opportunities for experimenting, sharing learning, and leading lasting change. We do this in lots of ways with lots of communities all across the US. We're really excited that you all are here today to kind of engage in this. And I'm hoping that you're feeling this energy as we jump in for that shared learning and that experimentation. Next slide. As a quick overview of kind of how we came about this, our real intention with these Fill Up Your Cup events is to bring folks together who are really doing that hard work of supporting collaborative partnerships on the ground. We know that this can be really challenging. We know folks are constantly searching for tools, trying to understand how to do this work better. And our intention for this space is to be kind of a relaxed, chill place that you can come, kind of a cafe style, just breathe in the happiness, the break, learn some things, and really connect with folks. So our agenda for today, we'll have some welcome and framing here, as you can see. And then we're going to jump into our real concept of focus, which is why might you want to asset and network map? We are going to land on one resource for the day. We'll go over several kind of an application, but really land on one, which is Kumu. And we'll talk a little bit more about that. And then we will have some opportunities throughout for discussion and then a poll and close. Next slide. So, for today's beautiful conversation, yes, I hope that makes you smile and laugh. We are going to be hosted by Sean Aluko, which is one of my colleagues here at the Population Health Innovation Lab. He is the Associate Director of Applied Research and Implementation. So excited to have him here today. He is a guru of all things network mapping. Really excited for him to share kind of at high level why this is such a valuable tool. And as you can see here, if you want to know, in our cafe, Sean really enjoys a good chai latte. So thank you, Sean, for your willingness to spend some time and share some brilliance with us today.
Of course, good afternoon, everyone. Welcome to today's Fill Up Your Cup series. I am super excited for this two-part series on assets and network mapping. And so, as I just said, two-part series. Today we'll focus on why asset mapping, why network mapping, why that matters in public health. And 2 weeks from now, at the same time, we will kind of jump into more of a deeper dive of using network maps for strategy and some intro into ways to make it easier to, visualize your mapping data via automation. And so our objective for today is to establish foundational concepts and demonstrate how mapping supports systems change. We will not be getting into the nitty-gritty details of that today. We'll do that. We'll save that for 2 weeks from now. And so today we'd like to focus on just defining what assets are, what a network is, and why mapping. And hopefully by the end of today, we've showed you the value of visibility and understanding gaps, duplication, and overburdened actors, showcase different tools that you can use to develop maps, walk through just one example to essentially help show what kind of questions you might be able to answer because of a network map. And then, of course, engage in some conversations with each other. The plan is to keep things at a very high level today. It is not necessarily a how to build a map in Kumu today, just more so really wanted to conveying how this can be used as a tool in your work.
All right, and with that, we're going to open up with just an initial poll here. So you should be seeing that launch on your side right now. We'd love to know, just to start us off, how familiar you are with asset or network mapping as a tool. So if you could just take a moment to respond to that question. Thank you so much for this feedback coming in. That's super helpful. And I will share those results in just a moment, but I'm seeing that we have the full gamut of folks from not familiar at all to some have heard about it, some are very familiar. All right, we're going to close that in just another second. I will end that poll now. Okay. And here are the results of that poll. So, Sean, we have the full gamut here. So, a couple people in the room are very familiar. A lot of folks, a lot more or somewhat. A few have really just kind of heard of it and not familiar at all. So, Thank you all for joining us today for this. I'm really excited for you wherever you are in this stage. I think Sean has some information that's relevant and helpful for all of us. And also just want to plug in that second session because if you're feeling like this is a really helpful like introduction, we're going to get even more in depth on like the strategy component of things during session two. All right.
Yeah, like Christina said, for those who are not familiar at all or just heard about it or don't know much, I think today's session is really for you. For those who are very familiar, I hope you learned something new today, and we look forward to seeing you 2 weeks from now when we get a bit in more depth on network mapping. And so starting really fundamentally, the question here is, what is an asset? And I know a lot of things might come to mind depending on the sector that you are coming from today. But to us, an asset is essentially any resource, tangible or intangible, that contributes to achieving a public health goal, supports community well-being, or strengthens a system's ability to respond to needs. Some examples of what an asset may be, as visualized on the right side of your slide right now: people. People are assets. These people can be community health workers. They can be your infection preventionists or IPCs at your hospital. They can be program coordinators. We know that programs and services are also assets. A mobile vaccination clinic is an asset. A food assistant program is an asset. Mental health counseling is also an asset. Assets can also be infrastructure. Clinical facilities, mobile health vans, and telehealth platforms are assets as well. And then lastly, trust anchors can be assets. Faith leaders, cultural liaisons, respected local organizations. And these are just a tiny chunk of what an asset might be. Again, just small examples of any resource that can contribute to achieving a public health goal, supporting your community's well-being, and strengthening systems' ability to respond to needs. And why does this matter? Identifying assets really ensures that existing strengths are leveraged before building new programs. This helps to reduce duplication and really helps increase coordination, as we'll touch on later on today. And so moving from assets, what is a network? A network, as we defined it, is the web of relationships, interactions, and connections among individuals, organizations, systems, or other assets that enable the flow of information, resources, referrals, or influence a system. And some examples that may be relevant to those attending today. We may have some formal referral networks. I think I saw some local health departments on the call. And so, a network might be your LHD connecting clients to housing agencies or WIC programs. We can have more informal connections as well. This can be something like peer support among public health nurses across counties or within one health department. We also have interagency collaborations or cross-sector collaborations. And so connections between tribal health clinics, they can partner with regional hospitals for specialty care. We have coalition memberships, which can be multi-sector task forces that work on a specific health topic, such as overdose prevention. And why does this matter? It is really important to understand the network because it helps us reveal strengths and where vulnerabilities lie, such as potential over-reliance on a single connector or missing links between critical services. And so what is asset and network mapping? Asset and network mapping is essentially the process of identifying and visualizing both the resources available in a system, aka the assets, and then the pathways through which they are connected or communicate, aka the networks, because this will enable strategic insight and system level solutions. In our illustration in the past 3 slides, again, community support ecosystems can be a form of network map. You can create a network map that shows service providers in a specific geography and how or if clients move between referrals. You can create a network map for outbreak coordination. My background is infectious disease epi, and this was something that we used during the COVID pandemic. It was really great to visualize patient flow between hospitals, skilled nursing facilities, and other health entities. You can create a network map for mental health ecosystem, which can display, referrals and feedback loops among schools, crisis teams, and outpatient providers. The sky really is the limit and all the different things that you can create on a map. And again, I think this is extremely important because this mapping really helps to pinpoint underused services. It helps to identify over-centralized actors, and it just really reveals previously unnoticed connections and can help guide smarter and a more efficient public health response. And so we discussed why asset and network mapping matters. Now I want to anchor in a simple truth. Um, you can't coordinate what you can't see. Looking at who's here today, again, I noticed that we saw some LHDs on the call, potential state health departments, some other CBOs and consultants, maybe. Your networks are all very diverse and probably spread over many sectors. If you can't visualize which CBO are working in food access, which county health teams are leading maternal health initiatives, or which trusted connectors link tribal health with hospital systems, you are probably left relying on what you know, what you've been made aware of by your organization, maybe chance encounters, or just whoever happened to hop in a meeting that you were in a week ago or 2 weeks ago. And that is why visibility is really powerful here. It's not just about having a contact list or just having data. It's about having a shared view that you and your partners can see, understand, and act on together. Mapping really makes those invisible connections visible, and that's when coordination like really starts to get really starts to work and get really efficient.
All right. So, as we mentioned up front for these events, one of our real goals is for you to be able to be in discussion. Like, we don't intend for these fill up your cup sessions to be drowning in content. We want this opportunity for you to really pause, reflect, share out loud, make connections. So, for the next moment or so, we want you to just consider on your own what assets are important to your community and the work that you do. Try to think of a key organization or a program, at least one, a physical space that's important, and a trust anchor, like a person or even a cultural asset or traditions of your community or the people that live there. Spend a moment thinking about those things and jotting them down. And then when you're ready, I want you to pop your responses into the chat. Okay. I know you're probably all deep in thought. I'm going to caveat this that you don't have to put all three of them into the chat if you don't desire to do so. Feel free to put the ones that make sense to you. But let's just see what's happening around your community. What's important to you all? Sean, accessible transportation. Yes. So important, such a helpful asset, and something really to consider a lot when you're thinking about public health infrastructure and well-being for communities. Allison, community-based organizations. We have two that provide CHWS, transportation and funding for us so we can better reach out community members. Oftentimes, we as government agencies have more red tape to go through. Yes, absolutely. To getting services quickly to community. Anchor orgs for Ginger, community partnership meetings and base meetings. Okay. Yes, Kitty bringing up under California's ecosystem, CalAIM, which is really funding a whole new network of supports for folks in the Medicaid space. Thank you all so much for these thoughts on assets. These are absolutely all things that can be, and we have mapped some of these things and are excited to share a little bit more about mapping. So I'm going to encourage you all, please continue thinking about this. Feel free to pop those into the chat. I think it's really helpful for folks, just context-wise, you may not even be thinking about something as an asset and then realize like, oh, this other community is naming this as something like really important. Maybe I should be thinking about this for my work and the application for what I'm doing. So thank you all so much for sharing your ideas here. It's really helpful. All right. Now we're going to go ahead and launch one more poll here. And now we want you to think similarly about these assets and the information that you've been sharing. Where do you actually track these community partnerships, resources, or other assets. So I'm going to launch this poll right now. And let's just go ahead and take a moment to think about this. Go ahead and respond. This may be multiple things that you do and have.
I love the in my head.
You know, I know that all of us have something that's just in
Mhm.
our head.
It's
You're
good.
probably using a lot of these techniques. Yep, I'm excited to share how many have the in my head response. It is a lot of us. There's often so many tools. There's overwhelm when you think about the amount of things out there, and sometimes that overwhelm stifles even your ability to put it anywhere. All right, I'm going to leave it up for just another second or so the last folks can get their responses in. Okay. And I'm going to share these results real quick. So we have the gamut again. Lots of folks, unsurprisingly, are sharing and storing information in Excel and spreadsheets. Funny enough, Sue, the in my head or personal contacts is like number two out of these. So a lot of people just like, okay, it's in there somewhere. I know I have all this information. It probably isn't well organized because we can't pull in and out of our headspace in our drawers, right? But lots of people just storing this information in their head. Also have other, would love to know what those are if you wouldn't mind putting those in the chat. I see at least one person. Or a CRM or partner database. Yes, those are absolutely helpful. And a lot of it's other, no centralized system. We experience this on our own operations in many different ways. We have lots of things that are organized and other things that are unorganized. And so I just want to recognize that that is normal, that is okay. And so we are here really to give you a tool that you might be able to use for some of these things. So thank you so much for sharing a little bit about where you currently are. Sean, over to you.
So, when thinking about tools, there are a lot of different tools, even beyond what is currently on my slide, that fulfill really different needs. I recognize that mapping can mean lots of different things depending on what your purpose are, and depending on that purpose, that is usually what leads to your tool of choice. And so starting with just Miro and Miro, these are really great tools for brainstorming and visualizing, visually organizing ideas, aka mind mapping. You know, if your goal is to capture concepts, workflows, or team roles in one place, mind maps are flexible and quick and still count as a network map, but they're not designed to show relationships between organizations in the system as well as others that might be accessible to you. A GIS mapping can also be used from asset and network mapping. ArcGIS exists, QGIS exists, a bunch of other GIS that I've never used exists. Google My Maps also is an option. And these tools are essentially all about geography. You know, they're powerful if your biggest question is where things are, such as where the clinics are located, which zip codes lack services. But sometimes they're not as great as showing how organizations connect or collaborate. I'm sure there are plenty of those on this call that I've heard of Tableau and Power BI, which are great, powerful data visualization software. And these dashboard creating tools are strong when you need numbers, performance, trends, outcomes in a visualized form. They're great for taking a lot of numbers and making it into easy images that are easy to synthesize and can actually provide you some information on performance related to your assets or even your network. They can answer the question of how much very well, but they're not too great at answering the question of who connects with whom. And then lastly, Kumu and Gephi. These are just two network mapping tools. They're great relationship network mapping tools. And I think this is where network mapping really shines. If your question is centered around connections, who works with who, where there are gaps, which group are hubs, network tools such as Kumu and Gephi give you a lot of visibility into that. They make relationships, not just locations or numbers, the data. And again, I'm not by any means here to sell Kumu to anyone, but that is our resource of the day. In our team's experience of network mapping across different softwares, we've used Gephi, which is great for network science. One that we've really come to love is Kumu because of its simplicity. It is a small learning curve, And I think this is the easiest network mapping tool to use across so many different use cases. So Kumu is actually a Hawaiian word that means source of wisdom. And I like that what this software is named because it really reflects the platform's aim for illuminating and clarifying complex issues within a network. It is designed for relational clarity, which makes it the perfect software for types of connections that you want to be able to manage. It is super interactive and clickable. You can explore without getting lost in a spreadsheet, even though it is built from either a linked Google Sheet or an uploaded CSV or spreadsheet. You can add layers, and so you might be able to see organizations, how they interact with other organizations, how they interact with services, how they interact with the people in your network, all in one place. And so, given we only have 45 total minutes today, this is one of the reasons why we made this a two-part series. Today, I will just show a simple example to just kind of spark some ideas. In our next session, we'll go in deeper detail into an applied use case and hit the nail on the head very briefly on the different ways to reduce the administrative burden of updating maps by talking about some very simple automative workflows. All right. And so this map that I'm going to now demo is a map that was actually created by Kumu. It is a map that contains data on organizations in, I think it's actually incorrectly titled, Baltimore Environmental Stewardship. All right. Can everyone still see my screen? I noticed that it is a bit small. I will zoom in, but just wanted to make sure.
Yes, we're good, Sean.
All right. So, as I said, this particular network map shows relationships between organizations in Baltimore, not Boston, that are involved in environmental stewardship. This map was built by the Kumu team, and I like this because it is a great entry-level map where you can really learn how to interpret and interact with the visuals. You can learn a bit about social network metrics with this map. And so today we will explore this data. We will view the same data in many different ways. We've sliced and diced it to basically be able to emphasize different pieces of the map. And then how to use this map we'll talk about how to use this map to ask the right questions. Again, a map is just a tool that we do something with. The network map is not the end goal. All right, so jumping into this map. On this map, this is the base view. This page has everything that has been inputted into Kumu. The Excel table feeds Kumu a lot of different informations about the different organizations that are in here based on the organization type, what the organization focuses on, their different projects, their funding sources, and other relevant traits for each of the organizations that are depicted in this map. On this map, each of these node or elements represents an organization. And so my mouse on the far right side right now, I am hovering over an organization. You will see that Upper Fells Point Improvement Association. Another organization that is depicted on this map, just picking random organizations here, Baltimore Medical System. Another thing that I really want to point out in this map also is, as I shall zoom in, you will notice that around each organization, there are some colors, around 1, 2, 3, 4, 5, 6 different colored arcs around this. Each of these arcs represents an activity that could be included in someone's definition of environmental stewardship. And I want you to reference the legend in the bottom left, and you'll essentially see which color corresponds with each activity. If an organization has one of those colored arcs, it means that they believe that that specific corresponding activity is an integral part of the definition of environmental stewardship. On the other hand, arcs that are missing from organizations, it means that the organization believes that the corresponding activity falls outside of their scope of environmental stewardship. Again, this is just a specific map here. I really want to encourage people to think about what this could look like in their specific sector or use case. If you were building this map with some of your data, maybe each of the circles actually represents your clinic, or maybe it represents your CHW program, or maybe your housing initiative. The arcs here could show these activities that you defined as core to your mission. It could be screenings, it could be outreach, it could be benefits navigation. It's an infinite list of what you can visualize here. And so I don't want people to get too fixated on a specific data that I'm sharing with them today. And so what you'll notice with this kind of map is you'll notice how some things show up strongly and how some things are missing. you can see immediate differences in such as for Blue Water Baltimore, all 6 of these environmental stewardship definitions show up for them. That is something that their program or their organization value as part of their mission. For the other organizations, City of Baltimore Office of Sustainability, we see that only 3 of them show up: advocacy for local environment, conserving local environment, and educating the public about the local environment. The other 3 do not show up here. And so it's just one way to just start to see all the different traits of all the different organizations that you may decide to visualize in your map. Another thing that I love about Kumu is, I'm going to zoom out and make all of this really small, is there are a lot of organizations in here. A great thing about Kumu is there are so many different ways to slice and dice your data. You get a lot of options for being able to filter by different categories in your data table that's uploaded into Kumu. And so, for example, I can filter out by, I'm only interested in federal government agencies here. You'll see now my map only has a small handful of organizations here. Maybe I'm only interested in 501c3s. When I click that, you'll see that my map has reduced in size. And so I wanted to flag that because it starts to become a really important tool, because you can really start to filter down, you can hide different things. And these tools really, really become a really great way to scope your data and scope what you are looking. But as I said, today isn't inherently a Kumu day or a how to use Kumu day. It's really more about what Kumu can help you see. And so let's go to a view that I have already filtered down here. On this page, I've combined different filters to narrow down the map to an exceedingly specific view, just to see the data that I want here. On this view, I'm filtering the map to show only the organizations that meet the following criteria. Their organization focus is either housing and shelter or legal services and civil rights. I filtered so that their funding source is just from the federal government, and then I filtered by a range of different funding amounts. In addition to this view, to these filters, I also toggled specific connectors. I am connecting sites to these different blue dots by project site type, and I'm hiding all the other social relationship connections. And again, this is just one random filter combination that I decided to create for this presentation. There are infinite more that you can do based on what you are interested in. And so here, I can see, if I go to park here, now I can see all the different organizations that have a park project type. If I go to forest woodland over here, now I will be able to see which organizations have a project that is categorized by happening in forest or woodlands. If I want to, just one more example, see who is doing a project with watersheds or sewer sheds, I can see who all those organizations are as well, and start to see some interesting things, such as some of those organizations are actually connected with each other. And so the key idea here is just to kind of show that, filtering is for the purpose of temporarily removing information so that it makes it a little easier to see the part of the system that is most relevant to your question. And without this, a map can be, if you go back to this very first map, a lot of organizations, a lot of lines from the very starting point. And it's really important to think about the specific thing that you are looking for. And I really want you to imagine that you filtered a map in your region or program area. Let's say only maternal health agencies or only those serving tribal populations. You'd immediately see not just who is in that slice, but you'd also see how or if they are connected or connect. And this is often where public health coalitions really notice missing relationships at times. And so I want to also show just a couple more things here. On this view and the upcoming view, I'm going to bring in the idea of sizing organizations based on a specific social network metric called degree. There's in degree and there's out degree. And essentially these can be defined as: in degree is the number of connections coming into an organization. Out degree is the opposite, as the name might insinuate, the number of connections going out of an organization. On this page, I have them sized by in degree. And you'll see that different from previous things I showed, the nodes are all different sizes now. Those that are larger have the biggest number of connections coming into them. Those that are smaller have the smallest number of connections coming into them. In practice, high in degree usually means an organization is looked to by others. for different resources such as advice, receiving referrals, resources, and maybe leadership. What stands out here for the bigger circles is that they're not just busy organizations, they're usually the ones that others in the system depend on. That can mean that they're trusted anchors, but it can also raise some questions. What happens if these groups are overloaded, or if they step back? And so when you look at InDegree, the questions to ask are, who is in our system is most relied on? Does this reliance make them anchors of strength or points of vulnerability? And does the map surface organizations that are relied on upon more than we realized? Similarly, out degree, again, as I said, this is the number of connections going out of an organization. The larger nodes here represents organizations that have the largest out degrees. And so like Parks and People has a much larger out degree than 32nd Street Farmers Market. Parks and People, these are the organizations that are the connectors and initiators. They help information or people move through the ecosystem. Out degree doesn't always equal influence, though. An organization might be spreading messages widely, but not all of them might land. And so when looking at a map like this that's already sized by out degree, questions that we may ask ourselves is, who is doing the most reaching out in this system? Are they effective connectors, or are they just busy ones? Are there organizations with surprisingly low out degree that might benefit from being more facing? And then the last thing that I wanted to show is a map that is actually sized by both in degree and out degree, aka degree, which is the sum of in degree and the sum of out degree. And so this map really shows a lot of the similar information from the in degree chart, in degree map, and a lot of information from the out degree map. And I really just want to show this one because, simply put, when you are sizing organizations by degree, it shows you how many connections that they have in total. It is a really quick way to spot the most visible hub in this ecosystem. Again, as a reminder, this ecosystem is on environmental stewardship in Baltimore. On this map right now, there are probably 3 organizations that pop out to you visually. On this far right side, Parks and People Foundation, we see City of Baltimore Office of Sustainability, and we see Blue Water Baltimore. These organizations are the ones that really sit at the center of activity here, whether it's because others reach out to them a lot, or they reach out to others a lot, or it's a combination of both. And so when we step back and look at this kind of map, again, questions that I ask myself is, are these the hubs that I expected in this specific ecosystem? Does this surprise me? Do these highly connected groups strengthen the ecosystem by linking others together? Or do they represent, again, points of vulnerabilities if they're not present? And then when I look at maps like this, I look at what opportunities exist for smaller or less visible organizations in becoming stronger connectors. And so something that you might be able to do is see who is Parks and People Foundation connected to, and see some of the other smaller organizations that collaborate with them. And so in this far left here, Curtis Bay Elementary School, is there something here that I need to look into in terms of their collaboration with Parks and People Foundation? That's just one way to start thinking about some of the information and some of the questions that you may be asking yourself when looking at a map like this. And so the real power here is that these questions really shift depending on your role, depending on your sector. As Christina said, there's no one size fits all when it comes to asset and network mapping. A state health department might look at degree to spot gaps in coverage or resilience. A housing nonprofit might focus on whether referrals are bottlenecked through a single group. A tribal health clinic may look at opportunities to elevate under-recognized partners. The sky's the limit. And so, while it's really tempting to kind of admire all the different patterns, the hubs, the clusters, and, the webs of lines that are currently on your screen, and the real value that network map really brings, in my perspective, is, what does what I'm looking at mean for us? What questions do we need to explore further? How can understanding how all these different assets are connected improve the efficiency in how our public health system coordinates? And those are the really powerful things that, being able to visualize data in this software, whether it's Kumu, Gephi, I'm sure there's a bunch of others that I've never heard of. Those are the value that they really provide you. One of the best use cases of network mapping isn't really to deliver hard answers. It's to speak to better questions and better ask questions about your system so that you can better improve your system. Okay, I'll now hand it back to Christina to open it up to our discussion. Again, that was a very high level walkthrough of a simple-ish map, and we'll go in more depth in our next session.
Yeah, thanks so much, Sean, for really just showcasing, I think, one use case and really going into some other additional examples of like how could a network map be used. And I think one of the things to state here is that mapping can work both ways, where maybe you start with a question that helps you to actually build out a map and start at one point. And then as you look at that map, it makes you start asking other questions and discovering new information that you didn't even think about. So there is this kind of like nice cycle of like you might have a starting point, but then also start to discover additional things. So we're going to open it up for again, we have less than 10 minutes left of our 45-minute session, but we'd really like you all to just be in thought right now. Like we've shared this map, we've talked a little bit about what you might be able to map, and you all are coming from across the US, from many different diverse organizations. We'd love to hear from you. Like what question might an asset map help you to explore? As you think about a starting point for what you want to see, what question might you be able to ask that you could actually look at through a map? So take a moment and think about those things. And we'd love if you just pop something in the chat. It doesn't have to be, you don't have to be super crazy, like beautified words, like just off the top of your head. What kind of question might you be able to ask and answer? And Jan, I saw your comment about the brain. I'm going to have to go back and look at that because I did not know about that organization or that tool. And if anyone wants to unmute themselves, you're also welcome to do that because this is all about networking and connection here. This is your space, so you curate the value that you get from this by being in connection with others. We are just hoping to provide a platform for you all to have some meaningful conversation here.
I just want to share, thank you for introducing this because I'm actually plotting in the map of the age, the workforce map of age birth to 8-1. I'm already kind of plugging in some of my partners in and all that stuff to make things happen. So I'm not reinventing the wheel. We have a really kind of visual example of using yarn. So we actually had a partner meeting where we have a whole bunch of partners together and we just using color yarns and see if we are connecting. And then it's like, so this is really great. Thank you for sharing.
Yeah,
Yeah,
I
that's
love.
so exciting to hear, Wendy. Sometimes when we deliver trainings related to this in person, that's where we start before we even go on Kumu. It's on pen and paper on the table. How are you all connected to each other? Let's see that.
Yeah, and I love that as a starting point, Wendy, and just the layers, as Sean talked about in that map, that you can continue to add onto the map to provide additional value as you come up with other questions or things that you want to be able to understand and visualize. Jan, thank you for that comment in the chat that you'd like to know what organizations are data connectors. That would be an amazing opportunity to look at that through a network map or an asset map. Anyone else? Ooh, yes. Okay. So, Debbie, yes, thank you so much for joining into this meeting. So, I feel like this could be used to help bridge the gap between employers and fresh grads trying to get into the network. That's awesome. What spaces are employing right now? What spaces offer internships to students? You are absolutely right. Like, that would be an amazing idea to have a filter on those types of things, but for an organization. That's an awesome, awesome application. Love it. Anyone else? CBOs and funders, yes, absolutely. And Sean, I think you put your favorite use case of mapping as of late has been understanding which providers deliver specific services under CalAIM among California counties. Yes, we have a map around that. CBOs and funders, absolutely. Cost of Kumu. So funny enough, we're not even sponsored by Kumu to do this, which would be very fun. But we are not. And Sean, feel free to jump into this.
Free. It's the crazy thing. Yeah. Kumu is at baseline a free web-based platform. There is a paid version for like $10 a month for if you want a private map. And so if you're mapping more sensitive information, you can pay a low cost of $10 a month for that. Otherwise, it is a beautifully free and accessible resource.
Yeah, super, super exciting. So it is a thing that's accessible to you all. You can literally go in today and start messing around with it. As we well know, sometimes learning new tools is its own sense of hurdle. And so more to come on that. Sean is, like I said, going to talk a little bit more about strategizing. Um, I'm loving this information all in the chat. I would encourage you to continue sharing information there. But I'm going to put in a plug for just kind of the next steps on some of these fill up your cup things that are to come. So next slide, Sean. For those of you that have kind of whet your appetite and gotten excited about like, oh, this mapping thing sounds kind of cool. I might be able to use it, or maybe I can find a map and really figure out how to strategize with it. I would highly suggest that you register to come to our September 3rd Fill Up Your Cup. It's going to be a very similar format, more laid back, interactive discussion. Sean will be leading this session as well. If you haven't had a chance to register for that one yet, I would highly suggest that you do so now. Registration for that closes on September 1st. And so we will be kind of going back to the same concept, not going so basic introduction, but really jumping into the strategy piece on that. So excited to actually bring back the community supports. I believe we're doing community supports map, Sean, right? Okay. So for those who did put that into the chat for the CalAIM ecosystem, we do have a map around community supports. So we'll be diving a little bit more into that and what that looks like. Next slide, please. And just as a teaser for you all to be aware of, we are actually really excited that we're going to be offering a mini training for those of you who really want to get into the ins and outs of how to do this for your own map. So next slide. We are going to be launching very shortly a mapping to mobilize training. So that's going to be more of a hands-on training. It will be about 2 to 3 hours. We're still finalizing content for that. But it's really for you all, the people that are here today. So you might be a community leader, or you're an organizer. Maybe you're part of a nonprofit or in a public health department, or maybe you're even a provider on the ground. For those of you who actually want to take this tool and action it and really figure out how maybe you want to use your own data to be able to do some of the strategizing work, this training will be for you. So be on the lookout. You will be get more information about this very shortly. But we are excited that you've joined us here today, and we're really hoping to get your feedback on this session. As we mentioned, this is just a basic intro. We're hoping you attend second session, but for right now, I'm going to launch a poll in the chat, the last poll here. Our real goal is for this to be a space that's valuable to you. So please feel free to like give us any feedback about what you really liked, didn't like. This is to be your location to come for any sort of information that feels relevant to you. So if you have other ideas, feel free to pop that also into the final survey as you're closing out. But otherwise, thanks for joining today. We'll be here for another few minutes as folks close their input here into the poll. If you'd like to stick around and chat, you're more than welcome to do so. And Sean, if you could just move 2 more slides in advance. For those who may not already be part of our mailing list or follow us on LinkedIn, we invite you to do that as well. We're excited that you've joined us today and really appreciate that. Thanks so much, Shirley. Thank you, Debbie. Thank you, Wendy.
Bye, everyone. See you next time.
Bye.